Trump administration splitting $50 billion for rural health care up among the states. Kansas set to receive nearly $222 million of that and can earn more over the next 4 years. Cale Chapman joins us after hearing from state lawmakers about the impact this funding might have on our state.
Well, Rachel, this new money could be a lifeline for struggling hospitals across the state. Governor Kelly said she plans to focus on 5 key initiatives. First, expanding primary and secondary prevention programs, securing local access to primary care, building a sustainable rural health workforce, enabling value-based care, and harnessing data and technology. I sat down with Representative John Carmichael to talk about why those points are so important.
If you live in Garden City and you need to see a neurologist, you're either going to Wichita or you may end up going to Denver, because we don't have neurologists, endocrinologists, psychiatrists. The list goes on and on. And so the program is designed not only to try to provide programs to expand the availability of care, but also to expand the opportunities for physicians in training to do residencies in underserved areas.
Future funding for the next 4 years of the program will be determined by criteria set by the Trump administration and whether or not states pass legislation in line with the White House's Make America Healthy Again initiative. If Kansas continues to see this same level of funding, the state could receive nearly $1.5 billion by the end of the next 5 years. Rachel?